So today we'll be talking about communication in the workplace. I'm Joshua Lee.
I'm Katie Duca.
I'm Chris Lewis.
Right, so today we're going to be talking about leadership and decision making in groups. This is from chapter 11, as we all know. First, I'm going to give you the definition of leadership. So basically, it is the ability to direct or influence others' behaviors and thoughts towards a productive end. Next, we're going to go on to brainstorming. Brainstorming is when members of a group all come together and share their ideas without any merit or any one of their ideas being judged.
Now we're going to be moving on to the topic of nursing in the workplace. Having strong communication skills is essential to collaborating with your fellow colleagues and nurses. It is also important to patient-centered care. The nurses who take the time to understand and listen to their patients are better prepared to address any upcoming issues, which result in better patient outcomes.
We're discussing what's on this slide. Leadership and decision making, also known as brainstorming, connects back to issues related in communication in the nursing workplace. Without communication, the profession of nursing would not be anything because it's all based off of talking with each other. Understanding the sources of power and group leadership behaviors in the workplace does help the communication overall. As you can see in here, the employers are talking with each other so that they all are on the same page and know what's going on.
As you can see, we are back on the topic of nursing. So pretty much, you must establish an open, secure dialogue with a healthcare provider or nurse. So basically, if you are a patient, you are going to want to have that connection with your nurse or doctor to be able to actually tell them the correct symptoms that you have. Because a lot of people who aren't comfortable with their doctors or nurses tend to tell them false symptoms and tend to not give them the full and honest truth. So then if they get the honest truth, they will be able to get the correct medicine and care that they are needed. Going into the essential forms of leadership, basically pretty much they are the sources of power, which we will be talking about in our next slide.
So there are 4 sources of power, and they're legitimate power, reward power, expert power, and referred power. Legitimate power comes from an individual's job title, such as a coach or a supervisor, and it can stem from an individual's ability to injure or threaten others. Up next, we have reward power, and it's an individual's ability to give out rewards. An example of that would be a boss giving out his employees a paid day off. Expert power comes from information or knowledge that a leader holds. Expert power is divided up into what we call JAWS, like the movie. And referred power can be classified as admiration, affection, or respect. For example, the popular kids in high school may have a different type of influence over the other students. They're not as popular.
So some overall examples of effective communication skills are active listening, written communication, verbal communication, presentation skills, education, compassion, role awareness, personal connections, and lastly, trust.
Moving forward with communications, there are 3 different types of communication skills. To begin, verbal communication is one. Verbal communication is key. Aim to always speak with clarity, accuracy, and honesty. So you want to encourage your patients to ask them about themselves, ask for more, and ask for if they need help or what they need. Forward with the second definition, it is nonverbal communications. Nonverbal communications is the use of facial expressions, eye contact, body language, gestures. So pretty much, if you are going to see a patient, you may not be able to speak to them, but you could always smile at them. Lastly, I want to talk about presentation skills. So pretty much, these skills will help demonstrate your expertise and knowledge clearly in the nursing environment. So, for example, to always plan and before you present is a really good example.
Okay, so some examples. We have active listening, written communication, and making personal connections. Active listening is the highest and one of the most effective, and it requires your complete engagement and attention. So nod your head and don't interrupt, and you want to lean forward, and you want to also maintain strong eye contact. An example of written communication is a patient's medical record, and it's really critical that the record is current and accurate. So you want to be able to write clearly and use simple language. Be sure to note accurate dates and times.
Ways to solve the issue of communication in the workplace are having weekly check-ins with your staff, letting them know how are they doing, are they okay with everything, and is there anything they can change to improve, and so that they know where everybody's role is and who they need to talk to. And as well as having a welcoming attitude as a supervisor so that your employees can come talk to you and you're always open, and having a great relationship with them so that they enjoy coming to work and know how to communicate with everybody.
This is our source.
Namaste.
Thanks for listening.
We appreciate it.